Doctor, what is graft and what is follicle? What is the difference between them, doctor?
So it's a very good question because people are really confused because some clinics say you need so many grafts, some clinics will say you need so many follicles, and even when they are charging, they will be charging according to the number of grafts or to the number of follicles. So it is very important for us to make a difference between what is graft and what is follicle. See, follicle is when I pluck your hair, the hair what you are seeing is a follicle. So if I pluck and if I implant, that will not grow. So we need that follicle with its complete unit. So that complete unit is known as follicular unit. So that follicular unit is known as graft. Each follicular unit will have follicles, and those can be single follicle or multiple follicle. And also it has the supporting structure for those follicles to grow. This complete unit is known as graft. So whatever we are extracting from the backside is the graft, not the follicle. So that's why the right way of telling you is the graft, not the follicle. When I am telling how much grafts are needed, or if we are also charging accordingly, we have to charge per graft, but I don't think charging per follicle is right way of doing it, because since each graft have multiple follicles, if you take for example 3000 grafts, in some people you can get 6000 follicles, in some people it can be 7000, and if the donor area is less, it can yield you only around 4000 follicles. That's why telling according to the graft is always very important than explaining in terms of the follicle.
Doctor, how long is the procedure, doctor? How much time does it take? And also, can you just tell me a little more detail about the post-procedure care that we have to take?
Time, it depends on number of grafts we are doing. So for example, if it is around 3 or 3500, approximately it takes around 7 to 8 hours. So ideally, if the patient comes in the morning, they can go back in the evening. So one thing to note here is this procedure doesn't need hospitalization. So it is a daycare procedure. You do the procedure, evening you can go back home. Since I told you that it is performed under local anesthesia, so there is no need for hospitalization. And for your next question, like what is the post care? So basically it's very simple. Like 1 week you have to be little careful for these grafts. So you should not expose them to sunlight, dust and pollution for 1 week. So after that all your activities can be resumed. So for 1 week period it is better to stay indoors and not to touch this area. We'll also be giving few antibiotics and painkillers, and also there will be a special solution, like we call it as normal saline, which has to be sprayed on the grafts. So that it is a very simple procedure. So post care is also very simple, and it is not at all a complicated procedure.
After how many days can I expect the results, doctor? And also, are the hair permanent? Am I not going to lose them?
See, after the procedure, first 3 months is known as shedding phase. So in shedding phase, we will be losing the transplanted grafts. So after 3 months, the grafts will start growing, and this is known as growth phase. And once they start growing, every month you see growth. By 6 months, approximately 80% of the growth would have happened, and by around 10 to 12 months, 100% of the grafts would have grown back. And one more thing you asked me was, are they permanent? So this is also like very important question. So we should understand one thing. So we are taking hair from the backside and we are implanting them in the front areas. It is mainly because these hairs are permanent. So if you see people outside who have lost hair, they still have hair on the back, hair on the sides, and also their body hair, their beard hair, because these are DHT resistant hairs. So whenever they are DHT resistant, they will be permanent. So even when we put them in the front areas, it will be permanent. So the transplanted grafts will not fall, but over a period of time there might be some thinning, especially like after 50s or 60s, but they don't fall. And one thing you should understand is there will be so many existing hairs also. For example, if we are doing only on the front area and these other areas are your existing hairs, the existing hairs might fall but not the transplanted hairs. So you have to take treatment and care for the existing hairs, but the transplanted hairs doesn't need any treatment or care.
What is the success rate, doctor? All procedures successful?
See, it is very important for us to select a proper patient for hair transplantation procedure. If your patient selection is right and also the person who is performing the procedure is experienced, then out of 100 people undergoing the procedure, at least 95% of them will have good results. And these 5% are the people, and there are some factors which are really unknown to us, but the success rate is almost 95% when the patient selection is correct and also when it is done in a good clinic under an experienced surgeon.
Doctor, I've seen people with poor and unnatural results. Why does it happen, doctor? And also, if my first surgery was not very successful, can I still get another surgery, revision surgery? Is it possible, doctor?
See, yeah, we do a lot of failure surgeries, and it is mainly because of a patient selection, as I told you, and also the clinic selection and also your doctor selection. So whenever you select a patient whose donor area is not strong enough, then chances of failure is very high. And also, if a person who doesn't have male pattern hair loss, for example, if their hair loss is very different, it's not a genetic hair loss, in such cases also if you do hair transplantation, then it might not be successful. And also, whenever a surgeon is performing the procedure, he should know how the hairline should be, the designing of hairline, the direction of the hair that is coming out, angle of the hair that is coming out. All these things has to be matched perfectly, otherwise it will give you a very unnaturally looking hairline. So it is, I am again and again stressing, it is very important that you decide your clinic and also the surgeon who is performing the procedure very wisely to avoid such unnatural results. Yes, we do a lot of revision surgeries. For some reason, if the results are not good and if you still have a donor area, then revision surgeries can be done. In some cases, we have also taken the graft from the hairline and we have corrected the hairline.